we're taking a look at platelet-rich plasma injection, or the P shot for men. Pre-apple shot, as it's known. I've got Dr. Nine in the studio, but well, let's do some Dr. Panya, right? Stay tuned. We'll be talking about the pre-apple shot, P shot for men. Hey, happy anniversary to you, Reverend Azigiza. 23 years, huh? I'm sure your papa is pleased, Reverend Markwe. One of your sons, huh? These songs, but hey, I've got Dr. Panya herself in the studio. And Dr. Na, Charlie, how are you?
Very well, thank you.
Hey, are you Dr. Panya?
No, please.
You sure? All right. Great to have you back in the studio. We're always grateful when our resource persons, professionals, practitioners take time off their Sunday to spend an hour with us. And last week, we looked at chiropractic interventions that aid breathing in many conditions, asthma, COPD, and quite a lot of stuff. Okay, I had a couple of questions hanging over from last week. Let me just quickly. Somebody asked whether the chiropractic physician can help with arthritis.
Yes, we do.
Okay, so they can also see a chiropractor?
Yes, they can come in. We'll have to do a thorough evaluation first to see if it's osteo. There are different types of arthritis.
Okay.
Whether it's osteoarthritis, whether it's rheumatoid arthritis. So that has to be determined first, and then based on what we find, we can recommend a treatment plan. But yes, we can manage arthritis.
Okay. Last week, there was also a caller who sent a message, wanted your contact, but I'll need to get your permission. From the number, I think the person is located in China. Your tentacles have gone far. So yes, folks, I do sometimes go over some of the messages because some of you judged me that I didn't do full justice. So yeah, I had one from China. This one says something about lumbar scoliosis. I think we dealt with that last week. The daughter who was having, who has thoracic scoliosis, right? We talked about that. There was one which was hanging. Okay, but I'll get back to that.
All right.
Okay, so today we want to delve into regenerative medicine, right? To regenerate, right? I have a few clues, but what exactly are we talking about here?
So regenerative medicine is a specialized type of healing where we're looking at natural things we can do to stimulate your body's ability to heal.
Okay.
So there are so many different types, but today we're focusing on what we call the platelet rich plasma, or
Okay.
for short PRP.
Okay. So if I hear something like, or I heard something like stem cell, right, and all those things, we're actually looking at body tissues, body material, bodily resources that are available,
Right.
that can be harnessed clinically
Clinically.
to help the body do something it is already programmed and
To do.
structured to do.
Yes, but we're trying to enhance the ability.
Okay.
You know, as you get older, there's what we call the normal wear and tear,
Okay.
which happens. And with the normal wear and tear, your tissues, your joints, all those things, the ability to heal or to regenerate also slows down.
Okay.
So with regenerative medicine, all we're doing is kind of forcing the body or stimulating the body
Okay.
to harness what it's already there,
Okay.
to use it to rebuild, regenerate, to rejuvenate those
Okay.
tissues, those joints again.
All right. I know some of the pastors say, you know, they lay hands, and they're also stimulating healing. If a pastor is doing things like this, would that be regenerative? Are they leaning and triggering and giving God's, should I say, divine system a jump start?
I can't answer that
You
one.
can't.
I-
Okay.
I don't know.
All
I
right.
don't know the mechanism behind that one.
Okay, all right. So the Osofos, I'll have you into the studio. I used to do a lovely session with Reverend Dr. Degbe, Fred Degbe, on healing and faith. So maybe we'll get into that later. Okay, so we're stimulating growth and healing using the body's own resources. Okay. Now, if we were to shift to platelet-rich plasma, what are we talking about here? Before we even get to the P shot.
All right. So platelet-rich plasma, you know, your blood or your blood serum has different parts. There's the white blood cells, there's the red blood cells, and then there are the platelets. So the platelets is simply the part of your blood which is responsible for healing. It's also responsible for clotting,
Okay.
or what we call thrombosis. So
Okay.
the platelets are harnessed when you have an injury, for
Okay.
instance, or when you have a wound.
Right.
The platelets are harnessed by spinning it in a centrifuge.
Okay.
And then we pull out that yellow portion called platelets.
Right.
And then we're able to use it wherever you have that injury. It may be a muscle, it may be a joint, it may be a ligament, it may be your hair,
Okay.
your skin. And we're able to put these platelets there again to stimulate healing.
Okay. If you just joined us, 13 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon. Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm with Dr. Na. Okay, I tried to label her Dr. Panya, but she shook it off. But we're talking about regenerative medicine and the P shot. Okay, and we're just learning what the platelet-rich plasma is. Taking a component of your blood, right?
Yes,
We put it
exactly.
through a process so that it is rich or concentrated. All right, and then we can inject this back into your body,
Right.
to help growth, healing, and so on and so forth.
Correct.
Okay. Of course, if you don't get it, WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. You can ask the question in your own words, and then I'll put them to Dr. Na. You can see, those of you who are online using those platforms, you can see she always comes with a bone to pick. So she got her bones by head, and I see some other,
Today I brought a second one.
a second one. What's that one?
So this is the model for the male reproductive organ.
Whoa,
Yes.
you didn't. So you brought it into the studio. So we'll be using it.
Yes.
Right. So instead of using a live
model.
subject, it's a model. All right. To explain what we're doing. Ziggy is smiling. He refused to be used. We're looking at issues here. But let me ask you now. So the platelets are already in the blood. They already have their function. Okay. So why do you have to go in there, take it out, shake it about a bit, and then put it back?
All right.
What's your business?
So let's say you have an injury.
Okay.
Maybe even an open wound, a
Okay.
sore, a
Right.
cut.
Mhm.
You realize that initially it would be red
Okay.
because maybe some of the blood vessels may have been affected. So you
Okay.
see the blood.
I see blood.
Now, as the days go by,
Mm-hmm.
the redness will start turning to yellowish
Okay.
or goldish.
Okay.
Okay. Now, that color change is because naturally your body is starting to put the platelets in that wounded area.
Right. So your body recognizes there's a breach,
There's
a
a
wound,
problem.
there's
Yes.
a problem.
Yes.
Okay.
So your body will naturally send those platelets there
Okay.
without you having to do anything.
Okay.
Okay. So with time, that open wound will start to close.
Okay.
It is the role of the platelets to close that wound until it is fully healed.
Okay.
So that's what the platelets do.
So essentially, you should, over time and perhaps in a short time, stop bleeding.
You should stop bleeding.
Your body should take care of that, close
Yes.
it, seal it, such that you are not
bleeding anymore.
Such that, so if we were to swing over and talk about something like a condition like hemophilia, then there's a problem with that process.
Exactly. Then you are just bleeding non-stop.
Right.
Because you can't clot. Your blood is not clotting.
Okay.
Exactly.
All right.
So it's the function of the platelets
Mm-hmm.
to put those clotting factors, healing factors on that wound
Okay.
so that it heals.
We understand.
So what we're doing when we inject the platelets there, like you mentioned earlier on, is to concentrate the number of platelets. For instance, if on a normal day, your body would naturally deposit 1 mil of platelets
Okay.
over a period of, let's say, 2 days.
Mm-hmm.
When we inject the platelets, now instead of that 1 mil, we're getting 3-4 mils.
You want a concentration.
It's heavily concentrated.
Okay.
So now you have times 3 times 4 of the same platelets,
Doing the same job.
doing the same job. So
Okay.
what happens now is it's going to fasten that healing process.
Okay.
It's going to cut the bleeding short. It's going to, the amount of time you're going to spend bleeding will be shorter. It will heal faster. It will close up faster. You will get back to your normal
Okay.
way faster. So that's why in athletes, for instance, the use of PRP has become very, very common.
Okay.
When they have sprains or strains, playing their sports, they resort to PRP a lot because the healing is faster. They're able
Okay.
to get back to the game quicker than normal.
All right, folks. That is irrespective of the team you're playing for. You can speed up the healing, but Charlie, if you are bound for relegation, you'll be relegated. But she's
Yeah.
talking about sports injuries
Right.
and how the application of platelet-rich plasma injections can now speed the process of healing. Okay. Now, Doc Na, we understand all this, even for a footballer and all that, right? But we are getting closer to where we say we'll go today for the
Okay.
men, right? Do we get injured down there, right? Because I've read about this. You've mentioned rightly skin, hair, joints, bones. You can use PRP. You can
Right.
use this concentrated platelet, whatever, is it a solution or whatever, collection of platelets, and inject it into a specific tissue or organ
Right.
to speed things up. But down there, do we get hurt? Do men get hurt down there?
So it may not be an injury like hurt.
Okay.
However, the tissues around the male reproductive organ very commonly as men age start to
Okay.
start to weaken.
Okay.
So both the male reproductive organ, there are muscles in there. There are also blood vessels in there.
Okay.
And the process of an erection is heavily centered on circulation of blood.
Okay.
So when these blood vessels or these muscles
This is when Ziggy decides to take a picture of me. Ziggy,
So-
we are concentrating blood to facilitate. Yes, so go ahead.
So when as you age
Uh-huh.
and these muscles or blood vessels are not working fully to be able to receive the blood into the male reproductive organ, then the functioning starts to reduce.
Okay.
So with the PRP, what we're doing is to stimulate those muscles,
Okay.
help the blood vessels to be able to receive more blood flow so that the functioning of the male reproductive organ is maintained or even improved.
All right, folks, 20 minutes past the hour of 2. We're focusing on regenerative medicine today, and we're exploring, with the help of Dr. Na and her model in the studio, the Priapus shot, the P shot, platelet-rich plasma injection for men who have some challenges down there, all right, the male organ, all right? And it does sound like there's a mechanism, a natural mechanism to facilitate penile erection, right? Please note, and I want to give this qualifier. Please note, when we're talking about erection or potency, we are not talking about fertility, okay? So yes, you may have a very strong organ or erection. You don't even need Dr. Nash shot, but fertility is a different issue. So let's get that clear. Somebody's asked you about erection. Say it functions normally. Can it still be empowered and enhanced even though it is not dysfunctional? So can you choose to intervene and give a man a P shot? He's not suffering. There's no problem. But as he wants to move from 3G to 4G due to maybe complaints or his own uncertainty, insecurity. Can you do that as an elective process?
Yes.
I just come to you. I want you to give me a P shot.
Yes. That's what we call wellness,
Oh, okay.
So long as you don't have any contraindications or you don't have any things that will prevent you. It's a natural process.
Okay.
It's your own blood platelets.
Okay.
We're not taking somebody's platelets to put into your body. So no, you can come in even if you don't have a problem.
Okay.
Just to maintain your wellness.
Hey,
yes.
You can come in and go and enhance your capacity. All right. I won't ask if you're supposed to inform your partner that you're boosting or anything. But all right, this is still clinical, serious business. All right. So let's look at the process. We know now that yes, there are many methods of regenerative medicine. PRP being one of them.
Correct.
Okay. Now you are a chiropractic physician. Okay. Are you also into this business, or are you going to send me somewhere else for, let's say, a doctor or a physician to do this? Okay, I realize it can be harnessed by many professionals.
Yes,
in many fields, but
it can.
Focusing specifically on you, why would I be going to a chiropractic physician for this procedure?
So I have taken extra training in this field. To be able to do the regenerative medicine, specifically with PRP.
Okay.
So not every chiropractor does this, but
you actually went for advanced training.
Yes, I did.
To go down there.
Yes, I did.
Hey.
To learn about it.
Okay.
But at Nova Wellness Center, I have a male physician assistant who does the.
You are not giving the shot yourself.
I am not giving the shots myself. I'm not. Even though I've been well trained in it, but
right.
I don't give the shots. I have a male, just so people are comfortable.
All right.
I have a male physician assistant who also has been trained.
Okay.
And he does the shots at Nova Wellness Center.
Okay. Right. We're going to get into the process. If you have any questions, concerns, we're on WhatsApp, Facebook, and YouTube. Ziggy is smiling, means he's seeing some questions there. Ziggy. All right. And shortly, I will activate the phone lines. We're focusing on regenerative medicine. Let's get the context right. Okay, we're stimulating your body in a particular organ or region to do certain things. Okay, yes, even if it's already doing that, we can boost or enhance it, right? And it's all well researched and well documented. It's not as if we're joking or doing some scam that will tell you that we'll do this, that. I know very soon I'll start getting the questions about will it increase size, this, that. We'll get into that. Okay, yes, because now I've got Dr. Na Ashele Ashite, CEO of Nova Wellness. You can find them in Jowulu and Kumasi as well, right? She's a chiropractic physician. We explained all that was last week, right? They offer the P shot. Mind you, there's also an O shot.
There is.
Let's just talk about the O shot so that women don't think because it's Father's Day we're just. So it means we can give a shot to women who have what kind of problem or what kind of desire or objective.
So for the O shot, again, same principle. We're going to take your blood, spin it in the centrifuge, and then harness the platelets.
Okay.
Now for the O shot, Some of the things that women get all short for are low libido,
Okay.
prolapse of the bladder walls.
Okay.
So, like women who have had multiple births,
Okay.
sometimes urinary incontinence becomes a problem.
Okay.
So, we're able to do the O shot for that as well.
Right.
And then, most commonly, for vaginal dryness.
Oh.
Again, as women are getting older, especially when you are becoming menopausal, very commonly there's vaginal dryness. So it makes having sexual intercourse more difficult and painful. But we're able to use the platelets to lubricate the area, stimulate the cells, to make the place more sensitive. And so that a lot of the times will help increase women's libido as well.
Okay. Why? I understand the purpose in the P. What's the O? What does the O stand for? Or is just another name?
I believe it's orgasm shot.
Chineke Ziggy. Okay, there's no commercial break. All right, we're continuing, and I'm sure you're getting educated. So we can give this shot for women
Yes.
with the kind of challenges you mentioned. When you
Yes.
talk about postmenopausal dryness and all that kind of stuff, I mean, I reckon that God didn't want us to be so busy in that area when we are older. So when you go and give shots to continue and extend, like, this is a footballer who should be retired. Are we not somewhat playing God or messing around with things?
No, not necessarily. I think that on a normal day, if we were doing all the right things, we're watching our weight, we're eating well, we're exercising.
Okay.
If we're doing all these right things for our bodies, then somebody will say we shouldn't age at all, right?
Okay.
But that's not realistic. So aging will happen whichever way you go. However, some of these simple things will just help to bring back some life, bring back some rejuvenation.
As Nova would say, live anew.
Live anew.
Live
Yes.
anew. I've been listening to your raps. Charlie, you have raps. So. Nova Wellness, live anew.
Live anew.
So actually,
yes.
you're not being naughty. You're enhancing your wellness.
Correct.
And it's available for males and females. And I got this. The brotherhood is proud of today's session. Ayeko, and then they changed my Nortey to Nortey by nature. So all these years, since 2003, the brotherhood has never
today.
saluted me. Today, you are saluting me. I'll write your names for shorts. Okay. So we've understood that. Right? Before we get into the process where you draw the blood and then do what you have to do to concentrate the platelets, is this suitable for everybody? I mean, there are men listening to us, there are women. Are there any contraindications, as we call it clinically, right? Something that says, if you have X, do not do Y. Is there anything that would be against my presenting myself for the platelet-rich plasma injection or the P shot?
So yes, there are certain conditions that if you have, we're not able to do the P shot.
Okay.
Cancer is one of them.
Okay.
Autoimmune diseases.
Okay.
Is also another one because the PRP is a stimulatory treatment. So if you have cancer or you already have an autoimmune disease and then we add the
We're
PRP,
going to stimulate that as well.
If you're not careful, you're going to worsen the condition. So at Nova Wellness Center, the first step when you come in, we're going to do a thorough lab test, actually.
Right. A full medical evaluation.
Full medical evaluation to make sure that your blood chemistry is all clear, even before we start the process.
Okay.
So,
So it's not Gina Hodge.
No.
It's not pass by, get a shot, and go back to the world and terrorize the world.
No, it's a process.
Right.
It usually takes anywhere from 1 to 2 weeks for us to start and then complete the shots. And even after you have received the PRP or O shot, usually you need to give it a few days before you check it out to see how effective it's been. So you need to give yourself about 3 days or so before you can have any sexual activity.
I hope you heard that and you're hearing it on Joy 99.7 FM. It's not Gina Hodge. It's not mucking around. It's not a scam. It's not a money-making machine where you are jabbing men. Maybe just the same way we have a center where you go for coronavirus and COVID virus and vaccine, and then everybody's trooping there.
No.
You must be properly, professionally medically evaluated, your
Yes.
medical history, your reproductive history, everything.
Everything.
All right.
Yes.
So
And
for
then
example, okay.
we also scan for STDs.
Okay.
Whilst we're doing that as well, because it's very important
Okay.
to make sure that we are not injecting infected blood back
into the system.
Yes, it's very important.
All
So
right.
we scan all these things at Nova Wellness Center. Once we get the lab results and you're clear, then we can do the PRP. We also have to make sure that you have a good quality of platelets. So
Okay.
if we check and your platelet count is low, that is also another contraindication.
Okay.
And that may be an indication of something else.
Right.
So it can be a process, like
Okay.
I said, before you actually get the shot.
I love that. So it's not, this is still clinical stuff. Last week we aligned, put into the should I say the health ecosystem where the chiropractic sits, and we talked about complementary, should I say, methods and health and all that. Okay, we're not saying don't see your other doctors. There are many other reasons why you may not be satisfied with what is happening down there, apart from your own preference and choice, right? For example, if you're diabetic, already it affects the blood vessels and many other things. And indeed, erectile problems in diabetes are well known, well documented.
Absolutely.
So let's say I have diabetes now and I come to you, I want you to pump up the jam. Do you just pump up the jam, or are there contraindications there?
So again, we'll do the lab test.
Okay.
We need to determine the extent of your diabetes. For instance, you have diabetes and your sugar is not well controlled.
All right.
Your sugar is constantly 15. That's quite high. So we can do all the PRP in the world, but so long as your blood sugar remains high,
Okay.
it would also affect the outcomes of the treatment.
Okay.
So if you have diabetes, we're going to have a conversation with you as to how to improve your sugar levels. Once that is better, then there's a high likelihood of you responding well to the PRP. But if your blood sugar is really bad, we are not going to go ahead and just give you the shot.
Okay.
We need to fix that first.
Right.
Same with blood pressure.
Okay. If you have
Same
high
thing.
blood
If you
pressure.
have high blood pressure, that even puts you at risk for so many other things. So we're going to have to make sure that your blood pressure improves before we do the PRP.
Okay, I hope you're listening. I see Dede is in before. Okay, it's a little after 2:30. When Dede gets in before 2:30, then I know, Charlie, we're in business. Where do they source the platelets from? From the individual? We're getting there, Dede. And are there age limits or considerations? All right, this is from Dede in Maryland. Dede, I hope you're keeping well. And maybe you might come in for an O. Or you want both? A PO. Good afternoon, Nortey. Kindly ask doctor if chiro can help with rheumatoid arthritis. We just talked about that. I tried it before, but I stopped along the line because no attention was paid to the fact that I was suffering from RA. And I felt I was being deceived. I'm on methotrexate for the RA, right? I want an honest and direct response. Hey, Sarah,
Oy.
Toboe. Note that, and I always like to make this clear, my guests don't have your full medical history. So they are responding to what we just seen and what I've read out. Dr. Na, anything you want to say to this?
Yes, very quickly. So rheumatoid arthritis is an autoimmune disease.
Okay.
It means that your body is fighting your immune system, and usually it affects your joints, So it will be very difficult for any chiropractor to tell you that they are going to reverse your rheumatoid arthritis.
Okay.
Because it's your own body that is fighting your autoimmune
It's already
system.
in war. It's at war. It's
Yes,
fighting itself already.
Yes.
Right.
So I have seen lots of patients with rheumatoid arthritis, and I make them understand
Okay.
that what I'm doing is to help you manage the symptoms
Okay.
that you are experiencing, managing the pain. It may be in your joints, it may be your wrists, your feet. So we're helping to reduce the pain.
Alongside your rheumatologist.
You need to continue doing
Okay.
all your medical treatments. Ours is to help reduce the pain and to help you go about your daily activities better.
Okay.
However, the response or how well your body takes that treatment is going to vary for everybody.
Okay, Elikam Nunana, right? The Ewa names always freak me out. And they're Well, I'll assume this is male, female. It can go any other anyway,
Yes.
right? Can I have Dr. Na's contact? Yeah, Ziggy and I are selling it, okay? But she will give the contacts for her locations, Accra and Kumasi, okay? Most of my guests, at least on my program, Ultimate Health, we have a policy. We don't just fly numbers out there, but where you can reach her facility, we can do that. So we'll get that out in a bit, all right? Dede asked about age limits and where we get the platelets. I'll quickly switch to that. Let me just read this one as well. Good afternoon, Nortey. Please, what causes spondylosis and what are the treatment options? Anytime I bring that, then they want to get everything one shot. My wife is going through waist pains after going through. Did we have this? Kwame Dansuman, he sent this last week, didn't he? Or is there a new one, Laura?
Yeah, I think we
we
talked
spoke.
about that.
Kwame, we spoke about that. Okay. After surgery, his wife was having. You want to say a quick word on that?
So it depends on what surgery it is.
Okay.
If it's CS, you need to have the sore fully healed. So, and that could be 2 to 3 months. So it depends on the surgery.
CS as in cesarean
Session,
Okay,
yes.
right.
So we would have to do the evaluation and see if it is safe for her to have our treatment protocols.
Okay.
Yes.
Great start. 36 minutes past the hour of 2 on Father's Day. And I'm glad we're getting a mixed, should I say, spread across males and females on our WhatsApp. Shortly, I will activate the phone lines and then we'll get into business. Let's find out how we are getting these platelets, okay? Now, Dede in Maryland wanted to know. We've mentioned already we are harnessing in regenerative medicine your body's own resources. So how are you harvesting this?
So when you come, after we have done all the tests
Okay.
and everything has been cleared, there are
Right.
no contraindications, then we would draw blood from, your own body.
Okay.
Usually we do the cubital, so that's the elbow.
Okay.
We'll just draw blood.
Inner elbow.
Yes.
Right.
and
What did you
the
call it?
Cubital.
Cubital.
Yes.
Chale yesua o. Because my listeners, when they unleash in town, it's not easy, cra. Cubital.
Yes.
Inner elbow.
Yes, your inner
Okay.
elbow.
All right,
Yes.
all right,
So
okay.
the blood vessels there.
Okay.
We'll just draw, just like how blood is drawn
Okay.
when you're not well and you go to the hospital.
Right.
So once we draw that, then the next level will be to put it in a centrifuge. And
Okay.
depending on what area we're doing the PRP, the amount of blood will change.
Okay.
For instance, when we're doing the P shot, we only need about 10 mils of blood,
Okay.
and then we would usually use about 4 mils
Okay.
with the platelets.
Right.
Yes. If we're doing both knees, for instance,
Okay.
we may do maybe 20 mils of blood, and then we would use about 10 platelets.
Canto shot.
Yes.
For the
yes.
canto.
Yes. So
Kotoje.
that's the orthopedic part for PRP.
So
yes.
you can get a PRP for your
Yes,
knees.
For the knees. In fact,
Oh,
that's
boy.
that's one of our biggest at Nova Wellness Center.
Right.
Shoulders.
Ziggy and I are coming.
Shoulders and knees.
Yeah.
Yes.
Ziggy's waist is bad news. Yeah. We sent him to Zoom Lion.
Oh,
Yes, but that's for waste management, and still.
it didn't work.
Oh, Nisisi Echia. Okay, folks, I'm going to activate the phone lines. 030-221-6541. WhatsApp is 055-1111-997. Ultimate Health on Joy 99.7 FM with me, Nortey by nature. And I'm in the studio with chiropractic physician, Dr. Nashile Ashite. She's the CEO of Nova Wellness Center. Hit me with those location contacts so that those bothering me for your number, I can do them later, sidebar.
Sure.
So, Jowulu.
So at Jolu, you can get us at 054 958 6494.
Okay.
Should I go over that again?
Yes, Jowulu.
Jolu 054 958 6494.
Okay. Can I find you guys online?
Yes, you can also find us on Facebook, Instagram, YouTube at Nova Wellness Center.
Okay.
Center ending in ER.
Okay. Not R-E.
Yes, not RE.
Okay. It's not Dr. Nashot.
No.
Okay. It's Nova Wellness.
Nova Wellness Center. Yes.
Okay. Great stuff. 39 minutes past the hour of 2 on Joy 99.7 FM. So you pass all your medicals.
Right.
We're good to go. Then we take the blood sample
Yes.
from the place called see something. We draw it out.
Yes.
We may draw different amounts or quantities
Right.
to
Depending
use.
on where
Okay.
we're putting the platelets.
All right. And then you mentioned the centrifuge.
Yes.
What is that? What are you doing to the blood?
So the centrifuge is a small machine,
Okay.
which spins at a very, 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 very high rate.
Okay.
So we spin it. We used to do double spin to get an extra concentration,
Okay.
but now regulations have changed. So we just spin it once.
All right.
Usually about 10, 15, 20 minutes, depending on the centrifuge.
Okay.
And so what that does is it separates the different
Components of the blood.
components of the blood.
Okay.
So by the time it's done spinning, the yellow or goldish color, which
Right.
is the color of the platelets,
Right.
would come to the top.
Okay.
I believe that's because of the weight of the different
Right.
components of
Okay.
the blood. So once we get that yellowish, goldish platelet color, and then we're just able to use the needle
take that
to
part
extract
out.
just that part out. That's the platelet.
That's what makes it a platelet-rich
rich
plasma.
Exactly.
Right. So
because now it's concentrated.
okay, so it's like separating egg yolk from the albumin, the white.
Correct.
Right. So you are
Correct.
interested in the yolk.
Yes.
So you spin it around, and now the yolk is separated.
Right.
And then you
We
harvest that.
harness that. Yes.
Okay. At any point in time, has my blood gone anywhere else? Have you done anything? So this is from my body into this machine, right? And then when you get the specific component of blood, which is the platelets you're looking for, it's coming back to me.
It's coming back to you. So
Do you have a platelet bank or something?
no,
I'm not
there's-
opening an account.
No.
I'm not leaving any body tissue specimen with you.
No.
All right.
Everything that we take out, we spin. Whatever is not used, that's the remainder of the plasma,
Okay.
or even the platelets that we don't use,
Okay.
is very well discarded.
Okay.
Yes.
Right. Now you mentioned something earlier. I want you to maybe hit on it again.
Okay.
If you have any conditions, any issues, medical, otherwise, that will compromise or contraindicate, make you unsuitable for this process, we will check and we will exclude you.
Yes.
Okay.
We would exclude you. Yes.
So somebody who has been dodging HIV test, STI test, and all that, here you have to do it.
you have to do it, and it's one of our regulations. And we have had people turn away because they don't want to do the test.
Okay.
Because we do check for HIV.
Right.
We do check for typhoid, and I think the
Hepatitis.
Yes,
Okay.
the hepatitis conditions. We check for all of that before we do the PRP. So
Okay.
if you are not willing or able to go through that testing, then we are not able to do the PRP at Nova Wellness
All
Center.
right, sit up straight, listen up. We're serious here. Ultimate Health on Joy 99.7 FM. The P shot for men. Yes, we are injecting you down there. So now we've understood how you get this, and you are now armed and ready.
Yes. Yes.
Okay.
And there's one step I forgot to
Okay.
mention.
Okay.
After you have done all the tests and everything is clear,
All right.
we actually put you on a diet, because to get good quality blood, it's going to come from what you're putting in your system.
Oh.
So unless you're already telling us that, look, I eat very well,
So essentially, you should be well.
so you should be well. Otherwise, we don't want to give you your poor quality of blood back to you. So at Nova Wellness Center, again, we give you a diet, a lot of water, a lot of greens, low fat, good proteins, and then you're going to do that for at least 1 to 2 weeks.
Oh.
That way, when you come in and we draw the blood, we're getting good quality blood. So
Okay.
if you have poor diet, you're going to have to clean all of that up before we do the P shot.
Great stuff, great stuff.
Yes.
And I guess that would apply if you're doing my knees or anything else. You want
Everywhere.
you want me to be in good tip-top health.
Yes.
You harvest good body materials.
Yes.
And then you put that back. And
Correct.
then you are, should I say, justified in expecting a better outcome.
Exactly.
All right, folks, if you just joined us, 44 minutes, I can't believe it, past the hour of 2. We haven't even touched the model. We're looking at the P shot, but it's more than a shot. There's a whole preparation process. I'm speaking with Dr. Na Ashele, Ashite, Dr. Na for short, not for short, for short, right? She's in the studio. Phone line 030-221-6541. WhatsApp is 055-11-11-997. Ziggy is well able to transmit your Facebook and other questions to me. So, hey, Fire. Give me your shots and I'll give them to Dr. Na. I have somebody already. Hello, good afternoon.
Hi.
Hello.
Hi, good afternoon.
Good afternoon. Happy Father's Day. You sound a bit dull. What's up?
I'm hungry. I'm hungry at the moment.
You're hungry?
Yeah.
Okay, please share your question with us. There's a lot of background noise though.
Yeah, I'm at an area. I'm just trying to find a place that's a bit better.
Okay, just share your question quickly and then we'll do
All right,
it.
sure. So with the shot, is it a one-time thing, or if you have to be doing it maybe within time?
Okay. All right.
Yes.
Okay. So is it one shot, as the name connotes? Is it one shot, pushing, and I'm done for life, I'm boosted, I'm enhanced, or do I have to keep recharging my battery?
So, for most people, once a month for 3 months
Okay.
is what we start with for most people.
Right.
So, once a month for 3 months, and then at the end of that, we'll reevaluate.
Okay.
If you're happy with your results, we'll ask for a review maybe by the 6th month.
Okay.
And then we'll check to see if still things are working as well as you'd like.
Okay.
And then after that, a year.
All right.
But most people, once they finish the 3 shots once a month, for most people, we don't hear from them again.
They're busy
They are busy.
doing roadworthiness.
Yes.
Can you imagine? 46 minutes past the hour. 2, Ziggy has somebody on my line. Hello, good afternoon. Whoosh. Hello. There's a lot of background noise. Hello.
Yeah, Nortey, good afternoon.
Good afternoon. Who's this?
Happy Father's Day.
Thank you. Happy Father's Day to you. This is, Ajingo.
Yes, I was.
All right, your background is bad. Quickly share your question, eh?
Okay. I want to find out now, is it possible that the election should be taking place?
Ajingo, please find another location and call us. It's unfair to my listeners and my guests. We can't hear you. All right. Apologies, Ajingo. If you're calling us, please make sure you're somewhere conducive so that we can all hear you home and away. We are international, right? So everybody wants to hear your questions and the responses. Okay. Yes. So now you haven't even held the model. How do you inject? Okay, whilst we wait for some questions. And let me read a couple of WhatsApp messages whilst you equip yourself with your model. Okay, so this was about Cairo and arthritis. RA, we've talked about that. Happy Father's Day to you and Ziggy. This is from Oye Nafienya. Thank you, Oye. I hope you're doing great. This one says Happy Father's Day to you, Pastor Kojo. Okay, right. Okay, Pastor Kojo, please. You receive it. Okay, good afternoon, please. What does it say? Is the PRP used in sickle cell crisis treatment? This is from Kiami, right? In sickle cell crisis treatment, that's what I've got here. Chew on that a bit, Dr. Nice, when she changes her face, I know she's processing something, okay? Right. Hey, I still have a lot I haven't read. This is Phyllis Buckman. This is from Phyllis. What does it say? Happy Father's Day, brothers Adote, Single, Stanley Ofori, Neville Buckman. God continue. Right from the bottom of my heart, Felix Buckman. To 2 special in-laws, Shola Oyeleke and Kwesi Akwa. God bless you from Phyllis. Okay, Phyllis, I've given them your shots, right? Please, I really need these shots because I struggle before I get into my lady. Okay, it's still Sunday. Sebi. Any contact and how much does it cost? I am currently on Wellman, right? Many people are taking some of these supplements, right? But still, no reaction, or I guess it means no improvement. Somebody who's like, yeah, I have issues. And we know there are physical and psychological things that can cause erectile issues, okay? And that reminds we haven't really properly put erectile dysfunction in. Right. Okay, sorry now. Go ahead.
Yeah, so do you want me to answer some of the questions?
Yes, please go ahead. Yeah.
Okay, so with the sickle cell, no. We're not able to do that because, sickle cell means that there's a change already in your red blood cells.
Right.
So more often than not, the platelets will also not be as efficient as we
They're
would
not
like.
optimum.
They are not optimum, yes. So
Okay.
we are not able to do the PRP for somebody who has sickle cell.
Okay, but that person was talking about when they are in crisis, I guess still.
So yes, still, because when they are in crisis, that is when the blood is sickling.
Okay,
You know, so
right.
that's when the shape of the blood cells have changed. So
Right.
that would affect the other types of the blood as well.
Okay, right. Gentlemen on Wellman Plus, okay.
So you know, with erectile dysfunction issues, we need to figure out what the source of the problem is. First
Okay.
of all, you know, you could be on Wellman, but if there's a mental aspect
All right.
to the problem, be it whatever,
Stress,
stress,
pressure.
pressure, being obese, you know. So if you're obese, for instance, and you're taking Wellman,
Okay,
and you have a lot of fatty tissue in your midsection,
right.
that is probably not going to solve the problem.
Already your circulatory system is
It's-
compromised.
exactly.
Okay.
Maybe you even have metabolic syndrome. That means you have high blood pressure, you have diabetes, you also have high cholesterol.
Okay.
Then your outcome is going to be, your prognosis is not the best.
All
So we would have to deal with all of that. Wellman is fine. I'm not saying don't take supplements. However, we need to clear all those things.
Whatever you are supplementing needs to be okay.
Yes,
Right.
yes. You need to make sure your internal environment is clean for the PRP to work.
Okay.
Yes.
Right. My question is that if I come, I can almost predict this. Where is it now? Thank you for the education on the topic. Now, before I'm understanding something, because when I was in school, our biology teacher taught about this. It seemed like a story the teacher is telling us. Thank you once again for your education, Hayford in Bato. Now, my question is that if I come and go through the process, how much does it cost, or is it covered by national health insurance? So cost and, should I say, coverage
Okay.
under insurance schemes.
So no, it is not covered by national health insurance.
Okay.
Unfortunately.
What about the other policies and the other schemes?
Even with the private insurance companies, not all of them
Okay.
cover it, but definitely I can say that the NHIS doesn't cover PRP. And then with the private ones, you know, it depends on your benefits.
Okay.
Everybody is different in what their insurance coverage is. So
Okay.
you would have to check with your
All right.
insurance provider.
Okay. I'm going in for a shot down there. Will you insure me? Okay. Right. Good afternoon, Nortey. Happy Father's Day. This is Ajingo who had a poor location. Is it possible to see erection done, and also too much of thinking stress contributes to inability to erect? Oh, Ajiman Joseph. This is your question. It's not erect too. All right. So he's asking of good sleep, diet, and all those things which you've touched on. He's asking, I think, whether you see results directly or daily. I don't know. It's a mix-up.
Well, so after the P shot is done, like I said, we usually want to give it a few days before you check how well it's working, how effective the procedure was. But for most people, maybe after the first one, you may see some results.
Okay.
But for majority of the people, by the time we do the second and third,
All right.
that is when you start to see very obvious changes.
Okay. The gentleman representing the Brotherhood insists I bring you back next week. The Brotherhood,
Wow,
the
the
Brotherhood
time is gone.
is friendly with me. But just quickly use the model and show us. Let's get to understand what the process looks like now that you've
Okay.
captured or harvested the platelets.
Yes. So the first thing after you harvested your platelets, or even whilst it's spinning,
Right.
we do numb the male reproductive organ.
Okay.
So the only place the platelets are going in is the male reproductive organ, or
You
what
don't
we
want
call
it
the
to be
penis.
sensitive.
Otherwise, it'll be painful.
Okay. So
Because
you
it's an
numb.
injection, yes.
You numb the penis, the male
Yes,
organ.
Yes,
Okay.
we numb it
Some
with just
form-
some local anesthesia.
some form of local anesthesia.
Yes,
All right.
yes.
Okay,
Just
understood.
some cream.
Yeah.
That way you don't feel, because you know that it's already
a
sensitive,
sensitive
and
place.
yes.
Uh-huh.
So once it's been fully numb, we
Okay.
have a way to check to make sure that they are not feeling the pain too
Okay.
much.
I say,
No, it's not. And the numbing, we need to say that it's not going to kill it. A lot
Oh,
of
no, no,
men
no, no.
are concerned, like you're going to numb it.
All
Is it what if
right.
it doesn't come back alive?
What if it
no.
becomes? What if it comes alive during the process?
I mean, it wouldn't be
My
harmful.
goodness.
It wouldn't be bad anyway,
Okay.
because it's not a very cumbersome procedure.
All right.
So once it's fully numb,
Right.
we're going to go to what we call the shaft
Okay.
of the penis. So
Right.
away from the head,
Away from the head.
but the shaft or the body of the penis. And then we
Okay.
have specific points
Okay.
where we would put the platelets.
Okay.
That way it goes into the muscle, the
Okay.
spongy tissue,
Right.
or what we call the cavernosum
Okay.
of the penis. That way we help to regenerate the tissue there,
Okay.
so that when you're getting an erection, it's a brain thing.
Right.
Actually, the process of erection,
The
it
brain
starts,
controls all of
it
this.
controls all of that. Information has to go from the brain through your spine. So the spinal nerves at lumbar 3, 4.
Okay.
Information has to go from there to get there to the penis before all of this happens.
Right.
So once we put the PRP in the shaft, it helps the muscles to relax.
Okay.
And then when the muscles in the penis relax, then the blood vessels are able to fill
Fill up.
with blood, and that is how erection takes place.
Right.
So we put the platelets there to help with this whole process
Okay.
to happen for the erection to start, and then it has to be maintained as well.
Okay.
So if the muscles there are weak, for instance, that is when maintaining the erection becomes difficult.
Okay.
So the PRP helps to strengthen those muscles in the shaft of the penis.
All right.
That way you can hold the erection longer.
Okay, now you've gone to erection, which is a very exciting topic, all right? But you're not talking about hold and maintain the erection as and when you are doing this procedure.
No.
You're talking about change over time.
Yes.
Yes, so you're not saying that you are giving this into the cavernosum and then you are expecting to see an erection.
No.
Back, back, back.
No.
Right, so
No.
you are looking at change over time.
Yes, it's a process.
All right.
It's a process.
Because
So-
listening to you on radio, it may sound like maintain and all that. So now I'm alive.
Yes.
And
now we finished the procedure.
Okay.
You've gone home.
Okay.
You are after a few days, because sometimes it can be a bit sore
Okay.
when we finish the procedure. So after the soreness and all of that is gone,
Right.
we expect that when you're about to have sexual intercourse,
Okay.
that is when now the process of erection
Right.
should be better.
All right.
Yes.
Start understanding that your erection is actually blood filling the tissues there and keeping those muscles turgid, right? Is that the word? Yeah?
Yeah, stronger.
Stronger, turgid, right? So it's like a vulcanizer pumping something. If the structures there are weak, the tissues are weak, this is where this PRP comes in.
Right.
Dr. Na has explained that there are other things that can weaken, damage the structures, okay? We've also gone ahead and answered, well, what if there's no damage? You're okay, but you want more power, right? This can be used in that way as well. All right. So once that is done, then what? I have dates, so I'm giving appointments for the
Yes.
boost. Are they booster shots? Can I use that term?
So you could, because in a month we would do the same thing again. Draw the blood, spin it, and the good thing with this process is that your blood keeps changing.
Okay.
So when we do the 3 months, at every point you're getting new set of growth factors, you're getting new set of proteins, you're getting new sets of what we call cytokines. And especially with the cytokines, it's very important because that's what helps us to build new immune cells as well as new blood cells. So
Okay.
if you just do one shot, you may not get the full effect of it. And that's
Okay.
why we highly recommend that you do at least 3 shots over 3 months.
Okay. P shot 1, P shot 2, P shot 3. And if you are called P square, then maybe it might change. But this is awesome information. So if I had arthritis and many other problems, this can be harnessed. Okay.
Same
Are you doing
principle.
any other applications? We mentioned arthritis.
Yes, so we do for the orthopedics.
Okay.
So our very first one was actually a shoulder problem. The person had severe frozen shoulder, couldn't move, and
Alright.
it's been about 2-3 years now, they have full range of motion in their shoulder.
Okay.
We do elbows, knees,
Waist.
yes,
All right.
sciatica.
All right.
That's with the neuropathy. We do plantar fasciitis.
Okay.
That's pain in the sole of the feet as well.
Okay.
Even the joints in your fingers.
Okay.
We do all of that with the PRP.
Trigger thumb and all those things.
Yes.
Okay. Dr. Na Panye, you can't go without answering and addressing. They're asking. We've done health insurance, but they want to know averagely what is this going to set me back? How much is it going to set me back? What's the cost?
So it really depends. We'll first have to do an evaluation. I've been saying once a month for 3 months, but everybody is different. Sometimes for certain joints, we even have to do it once a month for 6 months.
Okay.
So it depends. But I will give a range because I can't say, it will cost this much.
Okay.
But on average, it could be anywhere from 5,000 Ghana cedis upwards, 10,000
Right.
Ghana cedis.
Okay.
That includes from the consultation all the way to the lab test,
investigations
the
and all that.
investigation, the lab
Okay.
test, and then the shots themselves.
Alrighty.
Yes.
Okay. We're on the dot. 3 on the dot. We've answered all of these things. There is an elaborate assessment process.
Yes.
Okay. So let's
Takes
say I'm
time.
seeing an orthopedic specialist and I'm getting shots to my knee, whether they are
Cortisone
cortisone and
shots
all
or-
those things. Can I still come?
Once the cortisone shots are out of your system.
Okay.
Yes. Even certain drugs sometimes are contraindications. I think
Okay.
I forgot to mention that. So
Okay.
when you come in and we do the evaluation, if you're on any steroid medication, if you're on aspirin
Okay.
or any
Blood thinners.
blood thinners,
Okay.
yes, a lot of the times we'll have to make sure all of that is out of your system
Okay.
before we can administer the PRP.
Okay, the P shot on Father's Day. I'm thinking, right, since it's Father's Day, Nova Wellness, what are you doing for fathers?
So at our spa we have very nice packages.
Okay.
We realize that a lot of men don't like to treat themselves, so
Okay. Especially on
Yeah.
Father's Day. All the
Yes.
things that men have been doing, we should go and treat men at what?
yeah, you can come in for a massage, you can come in for a facial.
Say something to the women, the partners.
Right.
When it comes to what we've been discussing and what you do at Nova Wellness.
So I would say that it's very important to look out for some of these problems and not ignore them.
Okay.
Especially for men, we realize that this area, it's a very sensitive area for men. But the important thing is that you get checked.
Okay.
If you're not getting good erection, it may just be a symptom to a bigger problem.
All right.
So for women who may be realizing that things are not working as good,
Pressure.
yes,
Hey, where's that?
you want to encourage your man to have a full evaluation done. So that if there's a problem, I always say the sooner the better.
The sooner the better. Tileria tibota. All right. Dr. Na Ashele Ashite, it's always a pleasure, right? I have to find a way of getting Ziggy into this. And the name Ziggy goes with shots, So, but we are grateful for this education and the broader spectrum of application of regenerative medicine. And of course, the understanding that, hey, whatever you are seeing another doctor or physician for, please make sure and do disclose when you get to the chiropractic physician.
Absolutely.
Don't-
Whatever medications you're
don't
on,
hide information.
all of that is important.
Great stuff. Okay. I've done Daddy Lumba, but there's a gentleman called Lord Kitchener, and I want to go away with the needle for the men and Father's Days. They can stay on Joy 99.7 FM. My name is Nortey by nature. I've been with Na by Nova. Na by Nova. Thank you so much. And again, salute to the fathers.